now let's start. So basically this is your heart, and the biggest artery in your body is this aorta. So the aorta, wait, what's wrong with brachial? Sure, this is your aorta. Aorta is going to come out as what? The ascending aorta, then the aortic arc, then the descending aorta, which is here. So this aorta basically has like three. Let me reduce the vessels. Let me read the vessel. Has basically like three vessels that's coming out from it. This is a big brachiocephalic trunk. This is the left common carotid artery, and this is the left subclavian. Now on this brachiocephalic we have what? On this brachiocephalic we have the what? This is the brachiocephalic trunk. We have the right subclavian, and we have the what? We have the right common carotid. So basically we are going to limit our discussion to the subclavian artery. We can either use the left or right, so we can use the left or right. So let me just use the right. We can use the left or right. So we're just going to limit our discussion to this subclavian artery for this our upper limb discussion. So now let me just increase the artery. So now we have this is the subclavian artery, which you know. So we have like branch. Let's talk about the branch that are coming out of this subclavian artery. We have this one. So let me just add the skeleton, the bone, so you can appreciate this. So you can appreciate the artery. So now we have the internal thoracic artery coming out of the subclavian artery. So this internal thoracic artery supply what? Supply the breast. Do you get? See, from this you should be able to give you clue. So it's possible for you to give small supply to the pectoral muscle. You get? Possible. It's going to give, definitely it's going to give blood to them, but it's not the major supply to the pectoral muscle. The breast is mainly supplied by this internal thoracic artery. So even before, we call this artery the internal mammary artery. This artery can also supply, see, it's closer to the heart, the pericardium, supplies the pericardium. Now we have another branch. See this? See, this is called the what? Vertebral artery. See, this vertebral artery can supply like the spinal cord, can also supply the what? Supplies the what was it called again? Like, let's say, which muscle can we see here? The trapezium. Yeah, the trapezium. Let me just try and put the muscle so you can see. Let me try and put the muscle. So see, this muscle that are around here. See, wait, let me just try and, oh, I don't want to make things, I don't want to make it so complicated. So you see the trapezial, like basically this muscle, this levator scapula, yes, it has the ability to like supply them, since it's like, I don't know how to put it, but the possibility supplies them. So it's not that relevant. Or let's see what they have to. You see, this is muscles of the neck. It supplies the muscle of the neck, the vertebrae, the spinal cord. Yeah. So now we've talked about two. We've talked about the internal thoracic. We've talked about the vertebrae artery. Now let's talk about one of these important branch, which is called the what? The no, this is not the branch from it. This is what I'm trying to say. The thyrocervical. Let me try to like increase this thyrocervical. So this is the thyrocervical. This is the thyrocervical trunk. So we said we have the what? Internal thoracic, the vertebrae, and the thyrocervical. The thyrocervical is also going towards the neck region. I'm going to tell you one thing that is important about this thyrocervical. This thyrocervical will be the one to give you your inferior thyroid artery. You already know your thyroid gland at your lower neck, in front of your lower neck. You have your thyroid gland. So is this thyrocervical artery trunk that will give you the inferior inferior thyroid artery. And also basically this is your thyroid thyrocervical trunk The reason I call it the thyrocervical is because it's what it supplies the thyroid and it's around the what cervical region, so it's called thyrocervical. It give a branch which you all know. I'm sure you'll be happy to hear this, which is the suprascapular artery. So if they ask you, the suprascapular artery is coming from the thyrocervical trunk, and this one is known as the transverse cervical artery. And I'm sure you all know the function of the suprascapular artery, that it supplies the supraspinatus, the infraspinatus. Now the continuation of this subclavian artery is the axillary artery. The axillary artery. So this is one of the most important artery of the upper limb, the axillary artery. So this subclavian artery continues as axillary artery. So axillary artery, like I said earlier in one of our previous class, I said the axillary artery is divided into three parts by the pectoralis minor. Pectoralis minor divides this artery into three parts. You can see the pectoralis minor. The pectoralis minor muscle divided into three parts. So this is the first part. This is the first part here, around here. Then the second part is under the pectoralis minor. Then this is the third part. So first part is here, the second part is under the muscle, and the third part is this one here. So now let me remove this thing, and the first part gives off one branch. The second part will give you two branch. The third branch is going to give you three branch. So it's very easy. Let me remove the muscle. So we'll talk about those branch. Let me remove the muscle. Okay, now this is the first branch. This first branch is going to give us what we know as the superior thoracic artery. See, you can see that this superior thoracic artery will supply the pectoral region. So once you know all these artery, when you are talking about any muscle, just mention them. You can tell them that the breast, I'm sure the breast is going to be supplied by superior thoracic artery because of see where the superior thoracic artery is. So you see, once you know this artery of the upper limb, you'll be able to talk about the arterial supply of any muscle, any tissue. So now the first part of the axillary artery gives only one branch, which is the superior thoracic artery. The second branch, this is the second part of the axillary artery, is going to give us what we know as we said the first part is going to give you the one branch, which is the superior thoracic artery. The second part is going to give you two branch. This is one, and this is the second. This is the second one. So the second part of the axillary artery will give you two branch, as I said earlier. One of them is thoracoacromia. See, this artery is very important. This thoracoacromia, is giving this thoracoacromia will now give you another four branch. See, it's very easy. Another four branches. Do you know how I used to remember this branch? I just remember that cadaver are dead people. Cadaver are dead people. C is for the clavicular branch. This is the clavicular branch. So this is for the cadaver. Then which one is the cadaver? Is the clavicular branch. Then this one is the acromia. Cadaver are. This is the acromia branch. So cadaver are dead people. There's clavicular branch. There's acromia branch. There's dectoid branch, and there's there's the pectoral part. So if you are talking about the arterial supply of the pectoralis major or minor, you tell them the pectoralis major or minor is supplied by the pectoral branch of the thoracoacromia. Remember that the thoracoacromia is having four branches. Cadaver are dead people. Clavicular branch, acromia branch, deltoid branch, and the pectoral branch. So now this is how you do it. If you are talking about the deltoid, now since you remember that the thoracoacromia is giving us a deltoid branch, you tell them that the deltoid is supplied by the deltoid branch of the dectoral branch of the thoracoacromia. So that's it. Okay, I think this is, see the deltoid branch of the thoracoacromia. This is the pectoral branch. This is the clavicular branch. This is the acromia branch. So that's it. We said the second part of the axillary artery is having two branches. We've talked about the thoracoacromial. Now this one, you can see that this artery is somehow lateral to this your thorax, so we call it the lateral thoracic artery. So this artery should supply your what? Serratus anterior, because you know your serratus anterior is here. Yeah. I'm sure you are smiling. Yes. So this lateral thoracic artery is going to supply it. So now let's recap. We said your axillary artery is having what? Three parts. The first part is giving up one branch. And why is it having three branches? Because of what? Your pectoralis minor is lying here. So your pectoralis minor will divide into first part, second part, third part. First part will give you one branch. Second part will give you two branch. So the first part is going to give you the branch known as the what? Superior thoracic artery. The second part is going to give you two branch, which is the what? The thoracoacromia. Thoracoacromia will give you four branch, which is what? Cadaver are dead people. Then this, don't write it in your exam, just a mnemonic. Then this one is going to give you what? The lateral thoracic artery that will supply your what? Your serratus anterior and some other muscles that are related to this side. Then the third branch of the axillary artery will give you three branches. The third part will give you three branches, which is the what? C1, which is what? Anterior. See, this artery is anterior. Is now moving in a circular like way, so we call it anterior circumflex humeral artery. See the name, anterior circumflex humeral artery. That's one. The other one, which is posterior to it, we call it what? Posterior circumflex humeral artery. That's the second one. Now where's the third one, please? Where is it? This is the third one. Yeah, the subscapular artery. You can see. So the first part of the axillary artery will give you one branch, which is the what? Superior thoracic artery. The second part of the axillary artery will give you two branch, which is the what? Thoracoacromia and the lateral thoracic artery. The third part of the axillary artery is going to give you three branch, which is what? Anterior circumflex humeral artery, posterior circumflex humeral artery, and the what? And lastly is going to give you the what? The subscapular artery. So now basically what this axillary artery here is going to end at the lower border of the teres major. Let me put the muscle. So once this artery cross the teres major, we are going to change the name to what? Brachial artery. So let me put the teres major. It's very important. All these things I'm telling you, it's important. Oh, let me hide. Okay, let me reduce the muzzle. Let me hide this. Hide. So see, this is the teres major. So from the lower part of the teres major, the axillary artery will not change its name to what? Brachial artery. So this brachial artery, that's what we'll be looking at now. We'll be looking at the brachial artery. I'll soon end this. I don't want this to be too long, because this is one of the most important things you need to know. So look at this brachial artery. This brachial artery will be the one to supply the what? Artery of this anterior part of your forearm. You can see this brachial artery. See this brachial artery. It supplies your musculocutaneous, and basically like the artery of this anterior part of your arm. Then this brachial artery now give up one branch, which is the what? Profunda brachial artery, or the deep. Anytime you hear profunda in anatomy, it means deep. So it gives you the brachial artery is going to give you the deep brachial artery or the profunda brachial artery. See, this artery here is the deep. You can just rewind the video if you are not like getting me. Just rewind it. So this the brachial artery will give you what? The deep brachial artery or the what? Profunda brachial artery, which is going to be at the back of like the humerus. So it's just clear that that's the one that will supply your what? Your triceps. You know your triceps is posterior, so you can see. So it supplies the triceps. So now this our brachial artery is going to go down and give you. I'm going to stop the video now, because this is one of just, I want you guys to understand this first. So this brachial artery will now give you, see, two major vessels, which is the what? See, this is the ulnar bone and this is the radial bone. So it makes sense to say your brachial artery will give you what, the ulnar artery, and what, the radial artery. Then I feel that's just basic thing I'm supposed to explain to you guys. If you have any question, just let me know. Bye bye.